Assessing peripheral vascular system. First, we're going to wash our hands and wear our gloves. Then, we will provide privacy to the patient by closing the doors and curtains. Then, we will explain the procedure to the patient. Good day, ma'am. I'm Robert. I'm your nurse for today. May I know your name, ma'am?
Rachel Giwok,
What's your birthday, ma'am?
August 23, 2002.
Can I check it on your wristband, ma'am? Okay, ma'am. So today I will be assessing your peripheral vascular system for me to find if there are any abnormalities in your peripheral vascular system. Would you allow me to assess and touch you, ma'am?
Yes, sure.
Observe arm size and venous pattern. Also look for edema. Arms are bilaterally symmetric with minimal variation in size and shape, no edema or prominent venous patterning. Then next is we will observe coloration of the hands and arms. Palpate the client's fingers, hands, and arms and note the temperature. The skin is warm to touch bilaterally from fingertips to upper arms. Palpate to assess capillary refill time. Compress the nail bed until it blanches. Release the pressure and calculate the time it takes for color to return. And the capillary bed's refill in 2 seconds or less. Palpate the radial pulse. Gently press the radial artery against the radius. Note elasticity and strength. The next is we will palpate the ulnar pulses. You can also palpate the brachial pulses if you suspect arterial insufficiency. The brachial pulses have equal strength bilaterally. Then next is we will palpate the epitrochlear lymph nodes. Normally, epitrochlear lymph nodes are not palpable. Perform the Allen test. Use your thumb to occlude the radial and ulnar arteries. Continue pressure to keep both arteries occluded and had the client release the fist. Then next is we will observe skin color while inspecting both legs from the toes to the groin. We will also inspect the distribution of hair on legs. Then, inspect for lesions or ulcers. The legs are free of lesions or ulcerations. The next one is we will inspect for edema. The legs are identical size and shape bilaterally, no swelling or atrophy. The next is we will palpate the legs for edema. There is no edema present in the legs. Palpate bilaterally for temperature of the feet and legs. Toes, feet, and legs are equally warm bilaterally. Palpate the superficial inguinal lymph nodes. The next is we will palpate the femoral pulses. The femoral pulses are strong and equal bilaterally. Auscultate the femoral pulses. There are no sounds auscultated over the femoral arteries. Palpate the popliteal pulses. Then next is we will palpate the dorsalis pedis pulses. The dorsalis pedis pulses are bilaterally strong. This pulse is congenitally absent in 5 to 10% of the population. Next is we will palpate the posterior tibial pulses. The posterior tibial pulses should be strong bilaterally. However, in about 15% of healthy clients, the posterior tibial pulses are absent. And lastly, we will inspect for varicosities and thrombophlebotitis.